Perfect.
Well, I'm really pleased to be doing this interview with you, Dr. Snibbe. Did I pronounce that right?
Yeah, Snibby. Yeah, that's
Snibbe.
correct.
Well,
Yeah.
I've read a lot about you and your work, and I'll read a little bit about your background. It's extensive. You're Dr. Jason Snibbe, and you're an orthopedic surgeon. You're uh, do not only medicine orthopedically and surgery, but you have broad range of other interests, and you work to celebrities, sports teams, and a whole range of things which we'll get into. So, welcome. I'm glad to be with you, and look forward to our chat today.
Thank you. Thank you for having me. It's a pleasure.
Super. Well, um, I always like to start off when I do my interviews with, asking the people I talk to, and I talk to experts in various fields of what I broadly work in gender medicine and men's health in particular. Uh, your origin story. How did you get involved in medicine to start healthcare? What was the early motivator for you?
Yeah, great question. When I was inspired very young when I was in high school. So in 11th grade, there was a class called Physiology and Anatomy, and I signed up for it, and we learned about every muscle, every bone, all the attachments, and kind of a brief overview of like circulatory and neurologic and stuff like that. And I absolutely fell in love. From that moment, I realized like the human body and the kind of architecture of the human body was less like my thing. And so at that moment, I said I want to be a doctor, but I was always into sports. I played a lot of sports in high school. I enjoyed playing, and I said I kind of would like to do something in medicine that involves athletes, but I had no idea what orthopedic surgery was. I had no idea of anything like that. And then fast forward, I went to college and I ran into a random guy at a party. He was a friend of a friend. And he turned me on to this thing called student athletic training. These were students that work with the Division One athletes to help them with rehab and injury prevention. So through there, I got introduced to orthopedic surgery. I got to meet orthopedic surgeons that take care of the team. I got to go watch surgeries. I watched like an ACL. I watched a shoulder surgery, and then I knew, like within like sophomore year of college, I was like, I want to be an orthopedic surgeon. This is like insane. I love this. And I was always, as a child, I was always a person that loved to work with my hands. I built models, I built things. I always loved to fix things. And my father was a big, like, kind of, he loved to fix the house and always like fix things all over the house. And he would never fix it without me. He would say, "Okay, Jason, it's instead of a Saturday, we go like, ride bikes. We do that too. But like he'd say, let's go fix the refrigerator. Let's go fix the roof. Let's go fix this." And so I spent a lot of time using my hands and building things. And so that whole experience and joy of working with my hands came from that. And then I never looked back. I think one of the interesting things about me is, and just the way I am, the way I'm built is just I took my training very seriously. I looked at it as like I got one shot to be a master of this. It's almost like you're doing an apprenticeship. And so I took the art of surgery and the art of understanding patient care and stuff like that very, very seriously, and I was very intense about it during my residency, and it paid off because when I graduated, I felt so confident operating and taking care of patients. So and and today I'm 54 years old, 53 years old, excuse me, almost 54, and I've been in practice for 22 years, and I still to this day I wake up every morning happy. I like love to go to work. I love my job. I love my patients. I picked the right space for myself,
Super.
Yeah.
That's wonderful, and I resonate with a number of things you said. I've also been interested in health and sports my whole life. I have two grandsons that played in the National Football League and,
Wow,
wanted to be in sports. And eventually they went to college and eventually into the National Football League. They're getting ready to retire at this point. But sports and health
amazing.
are a really, really big part of my experience. I want to delve a little more into your own work, and uh, we'll get into some specifics about some of the things that athletes and other just people that are interested in health share. But what are some of the broad issues that you've learned in both your medical practice and your sports practice for the average person, the person that just wants to stay healthy, the average guy, the average woman that really wants to learn from the experts about how do we take care of ourselves?
Absolutely. I think it's important to say that, like, as an orthopedic surgeon, we take care of a lot of non-surgical things. And one of the things that we focus on and we pride ourselves on is telling people they don't need surgery and not being afraid of that. And I always tell patients, I'm like, we don't operate on your MRI. We don't operate on your x rays. We operate on how you feel and how the injury or the condition affects your quality of life. And I think that, when you look at a standard orthopedic practice, only about 30, maybe 40% of the patients that come into your office actually need an operation. The rest of them, that's 60, 70%, they're non-surgical. And so a lot of the things that we treat and I treat in my practice are things like simple things like tendonitis of the rotator cuff, tendonitis of the elbow, tendonitis of the patellar tendon, chronic overuse conditions. We also treat like things like arthritis, like mild arthritis, and also, meniscus injuries and rotator cuff injuries, things that like are chronic things that people have that don't necessarily need surgery, but we need to help them understand how to recover from it, how it affects their quality of life, and stuff like that. So we do a lot of non-surgical modalities to help those people, and we do that in athletes and non-athletes, and a lot of it is understanding the injury, but also the communication with the patient is the critical part. Is like so. For example, if you're an athlete, is your contract up? Where are you in your season? Did you just get? Are you like your grandsons who are like retiring from the NFL, or are they guys that just got drafted last week? So like depending on where they are in their career, we just make those decisions. And it's also the same for the regular person. So they may say, listen, my son is getting married in September and it's March right now, and I want to walk down the aisle and not have my knee hurt. So how do we get me ready for the wedding? Or I want to climb Machu Picchu, and like, how do I do that? So it's like understanding the patient and what their goals are, what their desires are.
But I'm really glad you said that. I identify. I was actually in medical school years ago before I left because I felt medicine was too restrictive at the time and didn't
Yeah,
look at the whole person. And I know from talking to a lot of doctors that um, surgeons tend to look through the world as surgeons, and other specialties do the same. And it's really refreshing to hear that you have a broader view of that and you look at the whole person. And I think that isn't true for everybody. And I appreciate you saying that. I know for me personally, I wanted to, just share. I have been an athlete my whole life. I've been on my feet. I'm 83 years old, so I've put a lot of mileage on my body.
amazing.
And I started to have some foot problems. I went to the doctor and they diagnosed some neuromas, and my doctor happened to be in sports medicine, and he recommended an orthotic that I've been wearing, and that really made a lot of difference for me about how my feet worked. And could you say a little bit about the feet and neuromas, maybe in particular? Because I know that's not an uncommon ailment that many people have that really can be debilitating, or it can, be something that can be dealt with in ways that get us back to doing the things we love to do.
Yeah, I think that's a great question. I think, when we think about the human body, I always tell people you can't be so tunnel vision in an injury. So, for example, someone has a back injury or a hip injury or a knee injury, a lot of times it can stem from the the foot. So, for example, like we talk about the body as a kinetic chain. So, you take a step with your foot on the ground. If that foot is painful and you're compensating in some way, guess what? You're putting abnormal stress on your knee, weird stress on your hip, weird stress on your back, and you start having all this compensatory problems because of that. So a lot of times, like for example, we see patients in the office where they say, I broke my foot and now I have on the left hip, on the left foot, and now my right hip hurts because I'm compensating and loading that other side. So neuroma in the foot is a very common ailment, and that's something that a lot of people suffer from. But treating that is very, very important, and understanding where the pain is, where it's localized, and how to treat it is important because if you don't treat that foot and you don't, if that person is not loading that foot in a kind of even progressive, normal gait, you're going to have all these compensatory problems throughout the whole kinetic chain, the whole body. And so it's very important to do that. And with neuromas, there's lots of different treatments. And the real common treatment now is platelet rich plasma, taking your blood and spinning it and shooting it into that area to create a healing response around it. We used to shoot it a lot with steroids, and that can help temporize things, but platelet rich plasma can really help a lot. And we try to avoid the surgery if we can, because cutting that nerve can create even more nerve pain sometimes. The other ends of the nerve can be painful.
Yeah.
But so I think that addressing foot issues is very important. And so footwear is very critical, making sure that people have shoes that have good support from heel to the toe. There's enough room in their foot for swelling, and then I also love orthotics. I like not the hard plastic ones, but the soft, comfortable orthotics or just arch supports are really, really important to support your arch. And it's not it's not to give you an arch, it's to support the arch that you have, the one that
Yeah.
you have, and that's critical.
Well, let me ask you a kind of follow-up question to that. I know, the orthotics that I've had have helped me, and I also am very aware of, that we're a whole body, and if you throw one thing off, you're going to throw everything off, and if you get one thing aligned, you connect, a lot of the parts.
Yeah,
But I also know that, not all doctors and not all experts have your experience and your point of view. So I have some friends that also, some guys in my men's group that have, foot problems, and they've been to all kinds of doctors and tried all kinds of things that seem to me to be, fairly traditional and, what you described with the injection of I had never heard of that, and I don't think they have. So are there things that that the average guy that goes to even an expert in their local area may not be aware of, and that you could alert or expand their knowledge about what they should look for or how they can find out things that a doctor may not know?
absolutely. So the whole world, there's a concept of a thing we call biologics. So using things that come from you or come from somebody else or from some other place to treat injury. So the most common one is called platelet rich plasma. Basically, we draw blood from the arm, we spin that blood down, and we take the platelets. So we remove the white blood cells, the red blood cells. We take the platelets that have all these amazing growth factors that release. And those growth factors, they do many different things, but one of them, it increases blood flow. The other one, it helps heal collagen and heal the tissue. And then the other one, it decreases inflammation, that lowers inflammation in the area. It's a thing that works slowly, but it can work to basically trick your body to say, hey, I have an injury in this area, come heal it. And that can be highly, highly effective to heal all kinds of stuff. Like it's used with meniscus injuries, mild osteoarthritis. It can be used in tendonitis. It can be used in nerves, and neuromas in the foot. And the foot, especially like plantar fasciitis, it's commonly used It's commonly used around the tendons, around like the tendons on the outside of your ankle called the peroneal tendons. It's used for that. Achilles tendonitis, it's used all the time. And we do those injections under ultrasound guidance. We use an ultrasound to guide it very perfectly right into those areas. And it can take about 4 to 6 weeks for it to work. It takes time. And then it sometimes can take up to 3 months. And sometimes it has to be repeated. Sometimes you have to do it again and again to get you across the finish line. Then sometimes one shot does the trick and kind of helps you and cures you. But there's other things too. Like there's another type of injection we use called bone marrow, where actually we put you to sleep, or sometimes you could do it awake, where we take a little bit of bone marrow from your pelvis and we spin that down and we use those cells. And those have growth factors, sometimes a little bit more growth factors than the platelets do. And we shoot those into different parts of your body. And then there's other things that are they use it in America. We're not allowed to use stem cells, but there's a thing called exosomes, which are basically the proteins on the outside of a stem cell. It's kind of the magic that the stem cells use. And so there's a lot of different companies in America that are developing FDA approved exosome treatment. And that's another thing that's used. And I've just started in the last couple of years using exosomes mainly for like osteoarthritis, meniscus, inflammation in like mostly the hip and knee and the shoulder. But I haven't used it yet in the foot and ankle yet. But we're going to start. But those are kind of the things that exist that we use. And so these are very common treatments, because the days of giving people cortisone shot after cortisone shot, as you know, the cortisone destroys your collagen. It breaks down the joint. So if it's an emergency, like if you say, hey, I'm going on a trip to Europe tomorrow and I want my knee to feel better, I'll give you a little shot of cortisone to get you through it. But as a main treatment, we like to use these other ways of doing it to help heal.
Yeah. Well, let me just ask you another question that comes to mind when you talk about what we do. And I know if I got this right, you work, your main clinic is in Los Angeles, is that correct? And
Yes.
that people come from all over the country and presumably perhaps other parts of the world to get the kind of treatment that you offer. Um, i in terms of people, we'll get into this more of how people can connect with you, but just in terms of people that are watching at this point,
Yeah.
uh, what are the options for people to get the kind of treatment? Is the only way to come to your clinic in Los Angeles, or do you consult or have other ways that people in other areas can take advantage of what you offer?
No, absolutely. I mean, I think that like, the world of, kind of the way longevity is happening in medicine, as you're involved in that, the idea of like looking at different aspects of medicine and being more a broad look of a patient, that space is exploding in orthopedics. And some orthopedic surgeons like myself that do surgery will do the have a biologic practice, which I do because I enjoy taking care of patients non-surgically as much as I love surgery. But there are some doctors that are either MDs, or some of them are MDs, and also some that are not trained as orthopedic surgeons. They're trained as what they call physiatrists, and those or pain management doctors that have taken an interest in non-surgical orthopedics. And so they call themselves like some of them are called pain management specialists, or they're called, they have biologic institutes or regenerative
Mm,
clinics. So there's many of them all over the country that do this type of treatment in different areas. A lot of the big cities have some really great ones, like myself, like in LA, and then there's people like in Dallas and
yeah.
Chicago. Some of the
But other
smaller,
other than the big cities and
yeah,
are there ways that we who are living, I live in a small town and many
yeah,
others do,
yeah.
that can learn about or take advantage of some of the expertise you have.
Yeah, you'd have to. I mean, I guess it's highly variable,
Yeah.
depending on the town. But there are some small towns that have people that do PRP and do these type of treatments, sometimes the towns have a lot of athletic people, like some of the towns in Colorado, like a little town
Mm,
like Boulder has
right.
people that do this because there's so many people running
Right.
around. But it's in my opinion, biologics are so compelling, and we've helped so many people heal that way. Um,
Hmm.
it's worth it if it's a 2 hour drive to get treatment.
Right.
I think it's worth it for a patient to get that treatment and get that alternative treatment because it's so powerful and so great.
Gotcha.
The problem with biologics is there hasn't, the issue with the FDA and the treatment is that there
Mm,
hasn't been a lot of massive studies on it.
yeah.
And so there's always a controversy. Some of the societies are like, well, it's not FDA approved, but it's so commonly used now. I mean, every orthopedic surgeon that I know that I'm friends with around the country does it routinely in patients all
Okay.
the time. So it's very common.
Okay. Well, one of the things I know when I went to my foot specialist locally, small town,
Yeah.
he emphasized shoes. You need to have good shoes, and I told him what I was wearing. He said, "Yeah, those are pretty good, but so shoes are an obvious thing, but what constitutes the best shoes is not, I think, immediately available, or people don't know what that is. And I understand, if I read about this right, that you have some recommendations, or a part of what you do has to do
Yes.
with good shoes. Can you talk about that a bit?
Yeah. So I've always been interested in the effect of shoes and the quality of shoes that people wear in their mostly in their work environment, but it just in taking care of patients and having support. So about now it's been what, 6 years? About 6 years ago, I have a really good friend that's a chef, and he approached me and said, "Hey, let's start a shoe company, but let's start a company that's for people that stand on their feet, people that are walking and moving." And
Mm,
so mostly, mainly for the workspace, people that work on their feet, they're working 10, 12 hours on their feet. So we developed a company that's a parody on my last name called Snibs, Snibbs, which is a shoe. And we came out with an initial shoe called the Space Cloud, and it's a shoe that we designed that basically, that the premise is that you want stability in your shoe. You want a shoe that's stable, but also when you take when you look at someone that's working in a restaurant, or someone that's on their feet all day, they're wearing like a running shoe. The problem with a running shoe is after about 2 months, maybe 3 months, the cushioning in that shoe is gone. It's just worn out when you're wearing it like 10 hours a day.
yeah.
So, so we decided to develop a patented like midsole that basically supports you, but can last up to a year with support and comfort, but also making a shoe that's resilient, and when you're exposed to elements like water and slip resistant, and kind of capturing your foot, allowing your foot to swell. And then as the years have gone by, we've developed all kinds of shoes that are lighter weight, breathable, shoes that are waterproof. We have a work boot. We have all kinds of different shoes. But I really believe that a shoe should have total support throughout the shoe, and also allow your foot to swell. A lot of shoes kind of trap your foot,
Mm,
and at the end of the day, your feet feel so painful.
hmm.
And I always say you shouldn't have a shoe that makes you think about your feet. We want you not to think about your feet. We want you to
Yeah.
think about your job, or think about reading your book, or spending time with your grandkids, or whatever you like to do. So, or hiking a mountain. So we like you to really have a comfortable shoe that supports you throughout the whole foot, and also allows, you know, great traction and great support. And then we have different types of shoes for different types of things. But I think it's important that the shoe is stable, because the instability that you have can really put a lot of stress on your ankle, on the muscles around your ankle. It can also create a lot of pain in your knee and your hip. And we're actually doing a study right now looking at people that walk and people that do exercise, and trying to understand, comparing different models of shoes to our shoe. So
Yeah.
hopefully that research will come out in the next several months to kind of show some differences, some real scientific differences in what
Yeah.
we have. Yeah.
So in terms of your shoes, obviously, uh, you'd like to have your shoes where people can find them and get fitted and so on. Again, is it something with your shoes in particular, and then I'll expand to other ways that people can take advantage of your work. But in terms of the shoes, do you have to come to Los Angeles? Is this something that you can get online? How does that work?
Yeah, it's online. It's direct to consumer. We have a website. It's snibs, SNIBBS.co, not com.co, co. And you can buy them online. And we have special discounts and deals that you can get. And we have different shoes that keep coming out. And we actually have we last year we came out with a women's clog that was designed by Nancy Silverton, who's a very famous chef from Los Angeles. And
Yeah,
so we've been doing some collabs with some different chefs and different
super.
people. So you can check it out. And there's a lot of interesting
Definitely check
designs out
that
there.
out.
Yeah.
So yeah, absolutely. So I will definitely check on it. And I have friends and people that will want to know about that and how to do that. So again, I kind of branching out from, my personal experience. I mentioned that my wife, Carlin, was similarly exercise, very physical, very athletic throughout her life. But she was out walking. This is 3 years ago now, and slipped on a wet sidewalk and landed on her butt, and called me, and I went and got her, and she seemed okay, but she's in her 80s, as am I, and we got her to the hospital. It turned out she had a broken hip and actually
Yeah.
the femur, and they had what's called hip replacement, but put in as you know, a rod into her leg, and
Yeah.
she's back and walking and back exercise. She's up on her treadmill. I heard her treadmill going earlier.
Oh,
But I
great.
understand from some information you shared that broken hips have become more common not only in older people but in younger people as well. And I didn't know that. Is that accurate? And why is that? Do you think? What's going on?
Well, I think that, there's a lot of different reasons. I mean, we're seeing more and more women, especially that are, there's this whole concept now of muscle mass, and people want to maintain their muscle mass. They want to maintain also bone density. And so there's this big push to continue to work out, to put pressure on your hips, to walk a lot, to 10,000 steps and stuff like that. And sometimes, especially in women in their 50s and 60s, we see a lot of stress fractures where people are walking and walking and walking, kind of over exercising, and
Mm-hmm.
they'll get stress fractures in their femoral neck. And then also, we're just active. I think that, like, it's very common to see a 63-year-old, 65-year-old person skiing like 50 days a year. We just
Yeah.
see these highly, highly active people, even sometimes in their 70s. They're skiing, they're mountain biking, they're cycling. So we just see accidents. Stuff happens out there. And so we see people falling and breaking their hips. But really, what's changed a lot is accelerating the recovery. And I think that what we're really, because these fractures are happening, we want people to, like, have the surgery quickly, get back on their feet quickly, to minimize the muscle loss after that
Right.
injury. But I think that, the concept of over exercising. The other thing that happened was COVID. And when COVID happened, everybody was exercising much more than they normally
Yeah.
did. So we saw a ton of femoral neck fractures during that time, because people would say, well, normally I walk 5 miles twice a week. Now I'm walking 7 miles every day. And I have a stress fracture in my pelvis, in my hip. So
Yeah.
that was happening a lot too.
Well, the other thing that I'm seeing among my friends and colleagues, and I hear from my patients as well, uh, and particularly in women, but men as well, falling and injuring themselves and breaking something or
Yes.
that. And I have probably three or four close friends and neighbors, who the dog, got caught in the leash and fell over and broke something. So obviously, we want to exercise. We like, don't overdo it, but are there some tips you could offer people that would? I hear about the overdoing it and the stress fractures kind of thing. What can you say to people about the potential for falling? There's some just natural
Yes.
dangers where you slip on a wet sidewalk, as my wife did, been walking that, but there was moss on it that particular day, and over she went. But
Yeah.
other general tips you might give to people that
Yeah.
are at least older and maybe at risk of breaking if you do fall, how do you prevent it?
So I think it's important to say that all of us as human beings get stenosis in our back. So the where the nerves are in your back,
Yeah.
it kind of clamps down. And so there, when you walk, there's a feedback that your feet and your legs give to your brain to understand the stresses on your feet and for balance. And as you age, because of the stenosis in your back, that nerve reflex is it lessens and gets dull after as you age. So it's very critical. The most critical thing is walking for patients as they get into their 60s, 70s, and 80s to always walk to make that part of your life. Like, and I tell patients, I say, you need to schedule it like you're scheduling an appointment, like you're scheduling a podcast, like you're scheduling a haircut. Like you need to walk, like from 7 o'clock to 8 o'clock, I am walking come hell or high water. That is uninterrupted time. And I think that as you walk, those reflexes, those nerves continue to get stimulated. And so the degradation of that reflex becomes not as severe. And then also muscle mass by increasing your walking and always moving, you're using all the muscles in your body, specifically walking, because it's different than bike riding where you're using most of your quads. When you're
Hmm.
walking, you're using your glutes and your back and your core. All of those are getting engaged to help you move and walk. And the other thing that's important, and I think people are always a little bit hesitant about it because they don't want to seem handicapped, is that I'm a big fan of hiking poles. So
Right.
hiking poles I think are wonderful because if you can walk, you're like, if I walk a mile, I just after a mile I feel weak and I feel unstable. If you can have hiking poles and you can walk 4 miles a day, that is 1,000 times better for you. And I tell people all the time, like if you go in my street in Los Angeles is treacherous. There's like all these curves. I mean, my kids who are like 10 years old, they're falling off their bike, they're hitting the sidewalk. It's treacherous out
Dangerous,
there.
yeah.
Right. And so having a nice pair of hiking poles, which costs about $100, it's very cheap. They'll last the rest of your life. They're super lightweight aluminum. Have those. And when you go to New York City, when you go to Europe, have those poles with you so you have a little bit of balance. And sometimes you don't need two, you just need one. But I think that's really critical. But the walking, I think, is the most important thing.
Yeah,
And I
that's
think, yeah,
that's music to my ears because I've been walking my whole life. I've been running as well. I used to run marathons and so on, and wear
wow,
and tear on my body. I've started just doing walking, and then when COVID hit, I'm male. I'm older. I wanted to lower my risk of dying if I got COVID. And so I started walking hills to add to, some lung, and that's been great. So, I've been walking in addition to my regular walking routine, hills for the last 3 or 4 years now, and my just lung capacity is better. I eventually did get COVID, as most people did, but I was vaccinated by then, and I didn't get
great.
sick. And a lot of it is I think I kept my lungs in good shape, and I teach in our little community, we started a walking program where we would walk and have big community walks 3 or 4 times a year around a
Wow, that's great.
10,000 step little that took you through all parts of our community. And now people just walk it on their own. We had a, a path that we
Wow,
put on the sidewalk. So that's going on in our community, and it just makes a huge difference. So I'm
it's
totally
amazing.
with you with the walking and the benefits of that. And my wife, who I mentioned after she slipped and fell and hip replacement, um, she got the walking poles. She decided that first she got one. She thought, "Ah,
Great.
I don't need two," and then that one was okay, but recently that one stopped. It started slipping. It wasn't one of the good. So I bought some real good walking poles, and now she walks, and now there's a whole little group,
Oh,
with walking
awesome.
poles that are
Perfect.
older people in her case and others that it just is making a huge difference in our community. So everything you've said is wonderful. I want by as we're wrapping up for today, I wanted to just see one how people can reach you and say your both your website for your shoes and also your general website so people who may be just watching this and need to write it down or remember it can get it. And then I want to, have a final wrap up of any things you might want to finish up with that we've missed.
Sure. My website is pretty simple. It's just drjasonsnibbe.com. And there's a lot of information about kind of the things that I do, the types of surgeries that I do, and the type of care that we provide in our clinic. And we're located in Los Angeles. And we do have a lot of patients that come out for, I do a lot of joint replacement surgery, and people will come out and do that surgery in Los Angeles, and we have a whole kind of concierge practice where we'll set you up with a hotel and physical therapy and stuff like that. So if you want to come out and have surgery, you can do it that way. And just also education. I have my Instagram is Dr. Jason Snibbe, and you can look at my Instagram. I do a lot of education on my Instagram about all kinds of things, orthopedic and health wise, and I do some collaborations with some other doctors as well. So yeah, come visit, come get educated, and learn.
Super. Well, say again the shoe, which is a different website. Say again that website.
Yeah, the shoe is Snibs SNIBBS.co. And it's a direct to consumer. You can order them online. You cannot get them out of the country. So you could if you have a family member that lives in Canada or Mexico, you have to order them to the US and then ship it yourself. But it's all in America, and they're wonderful shoes. And it's also a great shoe for anyone, for workers. If you have family members that work in restaurants, that work in healthcare, that work in movie sets, that work in anything where you're standing for long periods of time,
Great.
they're
Say it one
amazing
more
shoes.
time slow. I wanted to be sure I got all the letters in if people are just hearing it.
Of course. So it's SNIBBS. Double
So
B as
not
in boy
ES,
S.
just not like your name, but it's
Yes.
just the SNIBBS
Yes, exactly. .co.
dot
Exactly.
CO. Got it. Okay, well,
Absolutely.
anything final you would like to leave our listeners and viewers with? We will be following up, and I hope we can talk with you again and maybe have some
For
other
sure.
things we can get into. But this is
Absolutely.
extremely helpful. Any final words?
I think that the only other thing about longevity, I think is important, is just some generalized weight training, like having
Mm,
some weights. Because the other thing that with the balance and the reflexes in your feet, we lose muscle mass every year. We lose muscle mass as we age. So I think it's important for people. They don't have to be a bodybuilder. They don't have to lift heavy weights. You can buy some very simple weight material, weight like kettlebells or light
yeah,
weights for the home, and just doing some biceps and some butterflies and doing weighted squatting and lunging, just doing some stuff. Sometimes just a half an hour of just a little bit of weight training can really help you maintain your muscle mass. It's also wonderful for your metabolism, for the natural metabolism of your body, to have some weight training. And it's really critical because you just don't want to get behind. And I see this all the time where, you're so fortunate that your wife fell and broke her hip and got surgery, and now she's on her treadmill, right?
oh
She
yeah,
recovered. And so it tells us that when she fell, she had great muscle mass. She was a motivated patient. She was probably did a lot of walking, but unfortunately, there are patients that are not like that. There are
right.
patients that do never exercise, have completely weak muscle mass, and the problem with that is when they break their hip, sometimes that's the beginning of the end. And
Exactly.
they within a year, there's some data say 30%, some studies say 50% of those patients die
Right.
because they just takes them out because they have
Right.
no reserve. So I think it's important for people to understand that if you do this work now, it will save you in the end. It'll allow you, when you have it, God forbid, you have a catastrophic injury like a hip fracture, something bad that happens to you, you'll recover and it'll be behind you and you'll be great.
Super. Well, thank you, and I look forward to meeting again, and we'll say
Yes.
goodbye for now.
Okay. Sounds good. Thank you very much. Appreciate it.
You're welcome.